Hello guys, good morning. I welcome you all on Unacademy, India's largest learning platform. Myself, Dr. Nidhi, I'm your physiology educator at Unacademy. This is my Unacademy page, that is unacademy.com/KGMC. You will get the link of this page from the description box also. You can follow me out there so that you will get notification of any upcoming classes of mine. This is the code Dr. Nidhi. If anybody wants to join a paid course, you can use this referral code to get additional 10% off. I've taken many plus classes, many special classes, so anytime you can join and revise your topic. We are having three type of subscription: plus subscription, Unacademy iconic subscription, and Unacademy lite subscription. First, coming to this plus subscription, what all are the benefit? You will be able to access both the live and recorded session. If by chance you miss any session, you can see the recorded version. You have an opportunity to learn from India's top educator for the medical examination. We always conduct this live test and live quizzes. From that, you can analyze your preparation at any point of time. You have a flexibility. You can study on the device of your choice. आपका phone हमेशा आपके साथ होता है, phone से access कर सकते हो. If you want to go for the bigger screen, you can go for the bigger screen. We have a question bank which consists of a 25,000 plus question, high yield question, a clinical based question, and with explanation. So this is going to be very beneficial for all of you. We are having this Unacademy Lite for the NEET PG also, where you can access all the test series like subject wise tests, PG, INICT, and FMGEs. That is going to revise your topic before the actual examination, and it is overall consisting 2,800 plus question. We are launched with this auto daily practice paper where you get all after every plus live classes you will get to 5 to 10 MCQ that is hand picked by your educator, and that is related to the topic you studied in that session, and that is going to enhance your conceptual understanding. Moving further, we are launching this UPSC CMS. So as we discussed, 1 month fee of this is 2,475. 2 month fee is 4,500 only. So we are started with this also batch, that is MBBS first prof batch. 3 month the pre-launch price is 4,950. 6 month price is 9,000, and 12 month price is 10,800. So moving further, this is the fee structure of a NEET PG plus subscription. This is the fee structure for the plus subscription. This is the fee structure for the iconic subscription. This is the fee structure for the Unacademy late subscription, where you access the test series, all the test series. And this is the fee structure for MBBS first year subscription. So as per your requirement, you can enroll yourself and start your preparation right now. So moving further, we are going to start the revision of excretory system. Today we are going to study about the glomerular filtration rate, that is GFR. First, coming to the introduction. The functional unit of kidney is a nephron, and each kidney consists of approximately 1 million nephron. So this is important. And what is the function which is played by this nephron? The filtration is played by this nephron, and this filtration occurs through glomerular capillary. Now coming to this important point, that this glomerular capillary is a unique capillary. Why it is a unique capillary? Normally the capillaries are between the arterioles and the venules, but this is the unique capillary which is present between only two arterioles, that is afferent and the efferent arterioles. So that's why the glomerular capillary is a unique capillary. The filtration size of this glomerular capillary is a 4 to 8 nanometer, and the substance that is filtered from the glomerular capillary goes to the Bowman's space. And in a normal situation, the proteins are not filtered. So this is also important. The proteins are not filtered in a normal situation. Why the proteins are not filtered? See, because protein are anionic in nature, and our glomerular capillary is aligned by this heparan sulfate. This heparan sulfate is also anionic in nature. That's why the protein ion are repelled by this heparan sulfate of a glomerular capillary. Next reason, the protein cannot pass through the small fenestration. Glomerular fenestration is 4 to 6 nanometer, and protein cannot pass through that small fenestration. That's why protein remain unfiltered. Next, the slit diaphragm, which is formed by the foot process of podocyte, is small. That's why proteins remain unfiltered. So see, this is the diagram. This is the podocyte, and these are the foot process of podocyte. Between the two foot process, there is a gap which is known as slit diaphragm. This slit diaphragm is small in size and the protein cannot be filtered through this small slit diaphragm. That's why protein remain unfiltered. See the diagram of a normal capillary, glomerular capillary. So this is our glomerular capillary. The main function of glomerular capillary is filtration. The substance that is filtered from glomerular capillary goes to Bowman's space. Okay, this capillary is a unique capillary because it is present between two arterioles, that is afferent and the afferent arterioles. Okay, so अब आते हैं moving further. The slit diaphragm is formed by the certain proteins like nephrin, podosin and alpha-actinin. So they are basically providing the slit diaphragm integrity. So whenever this protein get under mutation, the slit diaphragm integrity will be hampered and protein will be filtered. So whenever the mutation of this nephrin occur, it leads to congenital finish type of nephrotic syndrome. Mutation of this podosin result into steroid-resistant nephrotic syndrome. Alpha-actinin mutation lead to focal segmental glomerulosclerosis. So these three are important. Do remember, slit diaphragm integrity is formed by nephrin, podosin and alpha-actinin. Now coming to the filtration force or the Starling force. To understand this filtration force or Starling force, let me draw a diagram for all of you. So suppose this is our glomerular capillary. The substance that is filtered from glomerular capillary goes to Bowman's space. Okay, so this glomerular capillary consists of a fluid component and the protein component. So fluid component is going to exert the hydrostatic pressure, which is known as hydrostatic pressure of a glomerular capillary. And what is the direction of this pressure? It has tendency to move into the neighboring compartment. The protein component is going to exert the oncotic pressure of a glomerular capillary and it has tendency to move water molecule towards itself. So this is the direction of hydrostatic pressure and the oncotic pressure. Now coming to the Bowman's space. In Bowman's space, proteins are not there. Only and only fluid components are there. And that fluid component is going to exert the hydrostatic pressure of a Bowman's capsule. And it has tendency to move into the neighboring compartment. So out here we are seeing the filtrative force is only and only this hydrostatic pressure of a glomerular capillary. This is the filtrative force. Rest two forces, that is oncotic pressure of glomerular capillary and hydrostatic pressure of Bowman's capsule, is our resorptive force. So from this diagram, we can see the net filtrative force is equal to filtrative force minus the resorptive force. So we can say net filtrative pressure is equal to hydrostatic pressure of glomerular capillary minus oncotic pressure of a glomerular capillary plus hydrostatic pressure of a Bowman's capsule. So this is a net filtrative pressure. And in normal situation, this net filtrative pressure is 10 mm of Hg. Okay, is this clear? Everybody understand what is the hydrostatic pressure and what is its direction? What is oncotic pressure and what is its direction? Everybody, is this clear? So see, this is the summary part. The favoring force is only and only the hydrostatic pressure of glomerular capillary and its normal value is 60 mm of Hg. Opposing forces are colloidal oncotic pressure of glomerular capillary and its value is 32 mm of Hg. Next is the hydrostatic pressure of Bowman's capsule is also the opposing force and its normal value is 18 mm of Hg. So we can say from this the net filtrative force is equal to favoring force minus opposing force. So these two are opposing force. So favoring force minus opposing force, and in normal situation this net filtrative pressure is 10 mm of Hg. In a normal healthy individual, we all know the proteins are not filtered, so oncotic pressure of Bowman's capsule is equal to 0. Is this clear, everybody? Everybody do reply fast. Is this clear? What is the Starling force, everyone? So moving further, now coming to the most important aspect, that is what will be the effect of afferent and efferent arteriolar constriction or relaxation on the GFR or renal blood flow. So first situation is our afferent arteriolar constriction. This afferent arteriolar constriction is brought by this the norepinephrine. Means our sympathetic nervous system stimulation is going to release this norepinephrine. So sympathetic nervous system activation is going to cause this an afferent arteriolar constriction. Okay, and in situation of a shock also this afferent arteriole undergo constriction. So due to constriction, what happened? Blood reaching to our glomerular capillary is going to decrease. So the glomerular capillary blood pressure decreases. So the net filtrative pressure out here will obviously decrease, and that's why the GFR decreases when afferent arteriolar constriction occurs. Okay, and this constriction is decreasing the blood flow, so we can say renal blood flow is also decreased. So this is the summary. Afferent arteriolar constriction is going to decrease the GFR, decrease the renal blood flow, and that occur in the presence of norepinephrine and the shock. Okay, coming to the next one, that is afferent arteriolar relaxation. This afferent arteriolar relaxation is brought by this prostaglandin E2s. And what does this do? Due to relaxation of this afferent arteriole. So see, this is the afferent arteriole, it undergo relaxation. So the blood reaching to our glomerular capillary is going to increase in this situation. Okay, and due to increase in blood flow, the glomerular capillary blood pressure will increase. So the net filtrative pressure is going to increase. So the GFR is increased. So we can say afferent arteriolar relaxation is brought by this prostaglandin, and it causes increase in GFR, increase in renal blood flow. Is this clear? Yes, Dr. Rao, it is going to increase the GFR. Relaxation की वजह से क्या हो गया? Blood flow increase हो गया. Glomerular capillary blood pressure increases. So net filtrative pressure is going to increase. So the GFR is going to increase. Is this clear? To reply fast. Is this clear with everybody? Okay, moving to the next one. That is efferent arteriolar constriction. So this is our efferent arteriole, it undergo constriction. So what happened out there? The blood outflow from the capillary. Blood outflow from the glomerular capillary decreases because of afferent arteriolar constriction. So that's how the blood accumulated in the capillary is going to increase. So it is going to increase the hydrostatic pressure of the capillary. So since hydrostatic pressure is the filtrative force, so the net filtration is going to increase. So the GFR increase. And out here the most important point is due to increase in GFR क्या होगा? Protein will start accumulating inside the glomerular capillary. Okay? Since protein are not filtered, it is going to accumulate inside the capillary, and this protein is going to exert the oncotic pressure. That is, oncotic pressure of a glomerular capillary is going to increase later on. And due to increase in this resorptive force, GFR decreases. So out here we can see the biphasic response is there. Initially, the GFR increases, but later on, due to protein accumulation, the GFR decreases. So the biphasic response will be seen in efferent arteriolar constriction. Is this clear with everybody? So this is very, very important, and this afferent arteriolar constriction occur in the presence of this angiotensin II. It is a vasoconstrictor. It constricts this afferent arteriole. Okay, is this clear with everybody? So out here, due to constriction, what happened? Blood flow decreases. So we can say efferent arteriolar constriction is brought by angiotensin 2, it is going to have the biphasic response. Initially, the GFR increases, later on it decreases due to protein accumulation, and the renal blood flow is going to decrease. Coming to the last situation, that is efferent arteriolar relaxation. Due to efferent arteriolar relaxation, what happens? The blood outflow from the capillary is going to increase. So the blood accumulated inside the capillary is going to decrease. So the hydrostatic pressure of the glomerular capillary decreases. So that's why GFR decreases. Is this clear? And this afferent arteriolar relaxation is brought by this ACE inhibitor. Okay, is this clear with everybody? So afferent arteriolar relaxation is going to increase the renal blood flow. So we can say from the summary, we can say relaxation of either the afferent arteriole or efferent arteriole. Both are going to cause increase in renal blood flow. So renal blood flow is going to increase in both the situation. Now coming to the constriction. Constriction of afferent arteriole or the efferent arteriole is going to cause decrease in renal blood flow. Okay, so this is the summary part. Do remember it. So moving further, now coming how this GFR is measured. The gold standard substance that is used to measure the GFR is inulin. And now coming to the criteria by which a substance is selected to measure the GFR are: the substance should be freely filtered, no reabsorption of substance should occur, no secretion of substance should occur, and substance should be non-toxic in nature. So these all four criteria are fulfilled by this inulin. So that's why inulin is known as the gold standard substance to measure the GFR. Now coming to the next, that is a creatinine. This creatinine is the most commonly used substance to measure the GFR. Gold standard substance is inulin, but most commonly used substance is this creatinine. Why the creatinine is the most commonly substance? Because it is an endogenous product. While this inulin we have to give from the outer side. And this creatinine also fulfill all these four criteria. So the most commonly used substance is the creatinine. Gold standard substance is inulin, but the most commonly used substance is creatinine. ठीक है? New marker की अगर बात करें तो new marker of GFR is cystatin C. Okay. Now this is the formula by which we calculated the GFR. GFR is equal to urine inulin concentration upon the plasma inulin concentration. Okay, urine inulin concentration upon the plasma inulin concentration into volume of urine. It is going to give this GFR. Normal inulin clearance is 125 ml per minute, and the normal GFR is also 125 ml per minute. So we can say this inulin is a gold standard substance to measure the GFR because its clearance is equal to the GFR, normal GFR. Is this clear? So this formula is very important to remember. GFR is equal to urine inulin concentration upon the plasma inulin concentration into volume of urine. This is the formula to measure the GFR. So now coming to the what is the importance of this measurement of the GFR. So normal renal blood flow is 22% of cardiac output reach to our kidney. And our normal cardiac output is, everybody knows that, it is 5 liter. So the normal renal blood flow is 1250 ml per minute. And we all know the plasma is 55%. In blood, the plasma is 55% and rest 45% is our blood cell. So we can say this plasma flow, when we are talking about the filtration, we will see this plasma flow. So renal plasma flow is 55% of a renal blood flow, and renal blood flow is 1250 ml. So the renal plasma flow is 625 ml per minute. Okay, and the substance that is used to measure this renal plasma flow is para-aminohepatic acid. Okay, this point is very important. To measure the renal plasma flow, the substance uses para-aminohepatic acid. This para-aminohepatic acid is 90% extracted by the kidney, 10% is excreted out. Okay, so since 10% is excreted out, when we use this substance to measure the renal plasma flow, the renal plasma flow will be underestimated. Is this clear? So when we are using this substance, the renal plasma flow is underestimated. So how we are going to measure the actual renal plasma flow? The formula is this one. Actual renal plasma flow is estimated renal plasma flow upon extraction ratio. The estimated renal plasma flow is 625 ml per minute. Extraction ratio, since it is only 90% extracted by the kidney, the extraction ratio is 0.9. So the actual renal plasma flow is 700 ml per minute. Next important formula or terminology is a filtration fraction. Out of renal plasma flow, how much is the filtered is our filtration fraction. So out of renal plasma flow, the filtered is GFR. So we can say the filtration fraction is GFR upon a renal plasma flow. The GFR is 125 ml and the renal plasma flow is 625 ml. So we can say in a normal situation, this filtration fraction is 20%. So this is important, do remember. Is this clear with everybody? अभी तक सेशन में किसी को डाउट? If anybody has any doubt, you can clear it out. Okay, moving further. Now coming to this regulation of the GFR. This is regulated by the two methods. Either by the auto-regulation of GFR is there, or this is brought by this mesangial cell. So first coming to this auto-regulation of the GFR. So what happened? Despite of change in a blood pressure, the GFR remained a constant. That is due to this auto-regulation part. So how it occurs? It occurs by the two mechanisms. The first mechanism is the myogenic autoregulation. So what happened? Due to increase in the blood flow, the arteriole will be stretched. So there will be stretching in the arterioles, and due to the stretching, calcium channel open up. And due to that, what happened? Calcium influx will be there. That is going to bind with the troponin C, and that is going to cause contraction. So vasoconstriction occurs and the blood flow decreases. Since blood flow decreases, the GFR is going to decrease. This is a myogenic autoregulation. See, this is the diagram. So this myogenic autoregulation work at the autoregulatory range, and this autoregulatory range is between the 80 mm of Hg to our 180 mm of Hg. This is the autoregulatory range in which this work. Is this clear? Myogenic autoregulation work. Is this clear? So now coming to the next important regulation is by this tubular glomerular feedback. So what happened? This tubular glomerular feedback occurs when increase in GFR is there. So when increase in GFR is there, the filtered amount of substance is going to increase. So the sodium chloride filtered will increase. And this increase in the sodium chloride which is filtered is going to activate the macula densa. This macula densa is the GFR sensor. So it senses the increase in sodium chloride filtered, means it senses the increase in GFR, and it releases this adenosine. and this adenosine is going to cause the vasoconstriction of afferent arteriole, and that's how GFR is finally going to decrease. This is a classical example of a negative feedback mechanism. Okay, so increase in GFR is going to cause a decrease in GFR. This is a classical example of a negative feedback mechanism. So this tubuloglomerular feedback is also a classical example of a negative feedback mechanism. Is this clear, everybody? This year also a feedback question was there. The baroreceptor, if anybody studied about this one, this baroreceptor is a classical example of a negative feedback mechanism. So this was also the question in our this NEET PG. So do remember this tubuloglomerular feedback is also a classical example of negative feedback mechanism. Okay. Shall we move to the further autoregulation part we have done? Is this clear with everybody? Hello, Dr. Kush. This was the question in our NEET PG 2020. So moving further, this auto-regulation, this regulation of GFR is also brought by this mesangial cell. GG cell we will discuss in the next session. For now, you see this GG cell is going to store the renin in the form of a granule. So that's why we tell this renin is stored in the form of granule. So this GG cell is also known as the granular cell of kidney. And it is a part of afferent arteriole. We will discuss this one in detail in the next session. Okay. So coming to this mesangial cell is also a part of a JG apparatus. Okay, this mesangial cell is normally enclosing our glomerular capillary. So suppose this is our glomerular capillary and this is our mesangial cell. So this mesangial cell is enclosing our capillary. Okay, so what happened? When mesangial cell contraction occurs, it is going to close the glomerular capillary. So it is going to lead the vasoconstriction. So the GFR decreases. So do remember, mesangial cell contraction is going to decrease the GFR. And this contraction is brought by this endothelin, angiotensin 2 or the norepinephrine. So do remember, endothelin, angiotensin 2 and the norepinephrine causes contraction of this mesangial cell, and contraction of this mesangial cell is eventually going to cause decrease in GFR. Is this clear? So endothelin, angiotensin 2 and the norepinephrine is going to cause a decrease in GFR. Next, mesangial cell relaxation. Mesangial cell relaxation is going to open up the capillaries. So it is going to cause the vasodilation. So the GFR is going to increase, and that occur in the presence of nitric oxide, natriuretic peptide and the cyclic AMP. These all causes mesangial cell relaxation. Okay, mesangial cell contraction is brought by endothelin or angiotensin 2. Mesangial cell relaxation is brought by nitric oxide, atrial natriuretic peptide and cyclic AMP. Good morning, Dr. Ram. Okay, so this is very important. They are basically also important for the regulation of the GFR. Is this clear with everybody? So see, this is the diagram. This is our glomerular capillary and this is our mesangial cell, which is enclosing our this capillary. Okay, so this is the also the summary. When mesangial cell contraction is there, it is going to close the glomerular capillary, so surface area decreases. Filtration surface क्या हो जाएगा? Decrease हो जाएगा. So the filtration coefficient also decreases. So the GFR decreases. So what is this formula? The GFR is equal to filtration coefficient into net filtrative pressure. This is the formula for the GFR. So when filtration coefficient decreases, When filtration coefficient decreases, the GFR is going to decrease. So mesangial cell contraction decreases the filtration coefficient, so GFR is going to decrease. And this occurs in the presence of angiotensin 2, vasopressin, adenosine, endothelin, platelet-derived growth factors. That's very good, Dr. Vairam. That's very good. So mesangial cell relaxation is going to cause opening of glomerular capillary. So since glomerular capillaries open up, so surface area increases, so the filtration coefficient is increased, so the GFR is increased, and that occurs in the presence of atrial natriuretic peptide, nitric oxide, and the cyclic AMP. Is this clear with everybody? To reply fast, this is all about the GFR. If anybody has any doubt, you can ask, or we will move to the question part. Is this clear? Shall we move to the question part then? So first question of today's session. Which of the following glycoprotein is found in a glomerular basement membrane? Chondroitin sulfate, keratin sulfate 1, heparin sulfate, or keratin sulfate? So everybody answer this question fast. Everybody answer this question fast. No, it's not a keratin sulfate, it is a heparin sulfate. काफी बार डिस्कस किया था आज के सेशन में. It is not a keratin sulfate. The glomerular capillary is aligned by this heparin sulfate. Coming to the next question. Tubuloglomerular feedback is for controlling blood sodium level, controlling plasma volume, controlling GFR, maintenance of systemic blood pressure. Everybody answer this question fast. Which of the tubuloglomerular feedback is for? Everybody answer this question fast. Tubuloglomerular feedback is for? Yeah, way true. It is for controlling the GFR. Coming to the next one. Following statement are true or false. Mesangial cell contraction increases GFR. Efferent arteriolar constriction decreases renal blood flow. Mild constriction of efferent artery decreases the GFR. Mesangial cell contraction increases the glomerular hydrostatic pressure. Which of the following statement are true or false? Everybody answer this question. Yeah, very true. A is false. And another option, what about another options? Mesangial cell contraction increases GFR, efferent arterial constriction decreases renal blood flow, mild constriction of efferent artery decreases GFR, mesangial cell contraction increases glomerular hydrostatic pressure. What about the option B, C, and D? Yeah, A is false. Efferent arteriolar constriction. Constriction of either the afferent arteriole is there, efferent arteriolar is there, renal blood flow is going to decrease. So it is true. This is false because mesangial cell contraction decreases GFR, not increases. So this is false. This is true. B true, C false. Yeah, mild constriction of afferent artery. Efferent artery constriction is going to have the biphasical response. So this is false. Mesangial cell contraction is going to cause increase in glomerular hydrostatic pressure. Mesangial cell contraction is going to cause decrease in the surface area, decrease in the filtration coefficient, and that's why GFR decreases. So this is also false. Is this clear? So only and only B is it true. Everybody, is this clear? So coming to the next one, calculate the net filtration pressure with the following data. Hydrostatic pressure of a glomerular capillary is 42 mm of Hg. Oncotic pressure of glomerular capillary is 12 mm of Hg. Hydrostatic pressure of Bowman's capsule is 16 mm of Hg. Assume that no proteins were filtered. So we have to calculate the net filtrative pressure. So everybody answer this question. I guess this is an easy one. So everybody answer this fast. Calculate the net filtration pressure with the following data. Yeah, way true. It is 14 mm of Hg because the formula says the net filtrative pressure is equal to filtrative force minus the resorptive force. So answer will be 14 mm of Hg. Coming to the next, GFR is increased by all of the following except increased renal blood flow, efferent arteriolar constriction, renal stone in the ureter, decreased oncotic pressure. GFR is increased by all of the following except. Everybody answer this question fast. GFR is increased by all of the following except. Yeah, way too. Renal stone in the ureter is going to cause the decrease in GFR. Rest all situation is going to cause an increase in GFR. Coming to the next, GFR is increased if increase in hydrostatic pressure in Bowman's capsule, decreased oncotic pressure in glomerular capillary, increased oncotic pressure of glomerular capillaries, decreased hydrostatic pressure in glomerular capillaries. GFR is increased if Yeah, way true, Dr. Rahul. It is going to exert the opposite pressure. So it is not going to favor the filtration. It is going to oppose the filtration. So GFR decreases. Yeah, way true. The GFR will be increased if oncotic pressure is decreased. That is resorptive force. So if we decrease the resorptive force, filtration is going to increase. If constriction to the efferent arteriole is there. Dr. Ailes, I guess you joined late in the session. What happened due to efferent arteriolar constriction? The biphasic response is there. So how the biphasic response is there? See. So afferent arteriolar constriction we are talking about. This one. So this afferent arteriolar constriction is going to cause decrease in a blood outflow from glomerular capillary. Okay, so due to decrease in a blood flow, the blood accumulated inside the capillary is going to increase. So it is going to increase the hydrostatic pressure of a glomerular capillary. So it is going to increase this hydrostatic pressure. So the net filtrative pressure is increased. So GFR increases. And we all know proteins are normally not filtered in a normal situation. So protein is going to accumulate inside the capillary. So this protein is going to exert the oncotic pressure. So the oncotic pressure of a glomerular capillary increases. This is a resorptive force. So by the increase in this resorptive force, the GFR decreases later on. Is this clear, Dr. Aids? This is about efferent arteriolar constriction. This is very important because here the biphasic response is there. Yeah, very true, doctor. Is this clear, Dr. Aids? Do reply fast. Okay, fine. Moving further to the next question. Efferent arteriolar constriction causes all except decrease in GFR, decreases the renal blood flow, decreases oncotic pressure in peritubulary capillaries, increases hydrostatic pressure in a glomerular capillary. So everybody answer this question. Efferent arteriolar constriction causes all of the following except. No, no, no. Answer it correctly. Efferent arteriolar constriction causes all except. See what happened in this question. Efferent arterial constriction has a biphasic response. We discussed initially GFR decreases, later on GFR increases. So this occur. This is true. Constriction. Wherever the constriction is there, blood flow is going to decrease. So blood flow decreases. This is also true. Oncotic pressure increases later on. That's why GFR decreases. So this is the wrong. It did not decreases, it increases. So answer is C. Is this clear with everybody? Is this clear? Answer is C. Coming to the next one. This is not related to today's topic. We will discuss in some another session. Next question. Two substances that can be probably used to determine infiltration fraction are insulin and mannitol, urea and diodrase, para-aminoparic acid and phenol with inulin and para-aminoparic acid impermeable in the loop of Henle. two substances that can be probably used to determine the filtration fraction. What is filtration fraction? Anybody? What is filtration fraction? Everybody answer this question fast. Yeah, way to the filtration fraction is GFR upon the renal plasma flow. So to measure the GFR, the gold standard substance is inulin, and to measure the renal plasma flow, we use the para-aminohyparic acid. Answer is D. Very good, everybody. So answer is D. Coming to next one, a filtration barrier has a pore which is the size of about 1 to 2 nanometer, 4 to 6 nanometer, 8 to 10 nanometer, or 10 to 12 nanometer. Filtration barrier has a pore which has a size of about. We discussed this one in today's session. Glomerular capillary has a filtration barrier, filtration pore of size, filtrative size of glomerular capillary. Okay, no issue. Remember this one? It is the 4 to 6 nanometer. Coming to the next one. Filtration pressure in glomeruli of kidney is? Filtration pressure in glomeruli of kidney is? Yeah, this is the easiest one. So the net filtrative pressure is 10 mm of Hg. So answer is A. Coming to the next one. Yeah, it's 10. Coming to the next one. In a normal person at a resting condition, the GFR is. This is also the easy one. In a normal person at a resting condition, the GFR is. Everybody answer this question. Yeah, way too. It is in a normal person, the GFR is the 125 ml per minute. The renal spleen, we will discuss this one in next session. This is about the threshold and the reabsorption. We will discuss the reabsorption part of our nephron in next session. So we will discuss this one in the next session. Okay. Is this clear, Dr. Yates? Today we are going to only discuss about the GFR. Coming to the next one. The normal urine flow rate is given, plasma inulin is given, urine inulin is given. Which of the following statement is true? Inulin clearance is equal to GFR. Inulin clearance is more than GFR. Inulin clearance is less than GFR. GFR cannot be calculated by above data. So we will do this question and we will do after the question part. Okay? We will do this renal display after the question part. So first, let me take you all to the GFR questions. So everybody answer this question. No, it is not asking about the normal situation. It is asking about this patient who is having this urine flow rate equal to 10 ml per minute. Plasma inulin is 20 milligram per ml. Urine inulin is 25 milligram per ml. So in this patient question is asking. So in this patient, first we have to calculate the inulin clearance. So the inulin clearance, the formula was, anybody? The GFR का formula जो था वो याद है सभी को? Inulin clearance is out here. Sorry, the GFR is out here. The formula for GFR is equal to plasma inulin, urine inulin upon a plasma inulin into urine flow rate. So it is 125 and the normal inulin clearance is also 125. So we can say in this situation inulin clearance is equal to GFR. So answer is A. Is this clear? Everybody, is this clear? Do reply fast. Is this clear? Do reply fast. Is this clear? Okay, coming to the next one. Two particles have the same diameter. Which one will pass easily through glomerular membrane? Positive charge, negative charge, any of the above. Charge has no relation. Two particles have the same diameter. Which one will pass easily through glomerular membrane? Yeah, way too. Positively charged will easily pass because our membrane, glomerular membrane, is lined by heparin sulfate, which is anionic in nature. Coming to the next one. A negatively charged molecule is filtered with more difficulty as compared to positive one because we already discussed because of presence of negatively charged siloprotein on the filtering membrane. Excuse me. Correct formula is GFR is equal to filtration coefficient into 10. Filtration coefficient is equal to GFR into 10. Filtration coefficient is equal to GFR into 125. GFR is equal to filtration coefficient into 125. This is also the easy one. Yeah, way two, it is GFR is equal to filtration coefficient into net filtrative pressure. Coming to the next one. GFR is increased when we already discussed this one, so skipping this one. Coming to the next one. Effect of a sympathetic stimulation on GFR is increased GFR with afferent arteriolar dilation, increased GFR with efferent arteriolar dilation, decreased GFR with afferent arteriolar constriction, decreased GFR with afferent arteriolar constriction. So everybody answer this question. Effect of sympathetic stimulation on GFR. Everybody answer this question fast. Yeah, wait. Sympathetic stimulation causes release of this norepinephrine. What does this norepinephrine do? This norepinephrine is going to cause afferent arteriolar constriction, and since afferent arteriolar is constrict, GFR is going to decrease. Yeah, wait. So answer is C. Coming to the next one. All should be a feature of a substance to measure GFR except freely reabsorbed, freely filtered across glomerular capillary, not secreted by kidney or none. Everybody answer this question fast. All should be a feature of a substance to measure the GFR except yeah, very true. No reabsorption should be there, no secretion should be there, and substance should be freely filtered. And substance should be non-toxic in nature. No, it's not C. Substance should be not secreted, not reabsorbed, and it should be freely filtered, and it should be non-toxic in nature. These are the four criteria. Okay, so answer is only and only A. Coming to the next one. The best test for the GFR is with inulin, hippuric acid, creatinine, para-aminohippuric acid. The best test for GFR is with. Yeah, very true, everybody. The gold standard substance to measure GFR is inulin. Coming to the next one. Best measure for GFR is serum creatinine, urine output, blood urea, nitrogen, or para-aminohippuric acid. Everybody answer this question fast. Yeah, very true, Dr. Al. It's serum creatinine. When option may we don't have inulin, we can go for the serum creatinine because it is the most commonly used substance to measure the GFR because it is an endogenous product. Not the urine output, not the blood urea nitrogen. Answer is only and only serum creatinine. Is this clear with everybody? Coming to the next one. Relaxation of a mesangial cell of kidney is brought by cyclic AMP, endothelin, platelet growth factor 2, vasopressin. Mesangial cell relaxation is brought by. Mesangial cell relaxation is brought by. It is brought by the cyclic AMP, nitric oxide, atrial natriuretic peptide. All these three are going to cause some mesangial cell relaxation. So answer is A. These all three is going to cause mesangial cell contraction, not a relaxation. Endothelin, vasopressin, platelet growth factor, all are going to cause mesangial cell contraction. Coming to the next one. GFR is increased by atrial natriuretic peptide, vasopressin, histamine, or the endothelin. GFR is increased by. GFR is increased by atrial natriuretic peptide because it is going to cause mesangial cell relaxation. Remember, mesangial cell relaxation is going to cause opening of many capillaries is there, so the surface area increases, so the filtration coefficient increases, so the GFR increases. So answer is A. Is this clear? Everybody, is this clear? Coming to the next, glomerular filtrate consists of all except bicarbonate, albumin, glucose, or sodium. Glomerular filtrate contain all except. Yeah, very true, everybody. Proteins are not filtered, so it will not consist of albumin. Coming to the next question, minimum filtration through glomerulus is for same. Our proteins are not filtered, so answer will be myoglobin. Skipping this one, coming to the next one. With increased flow to the loop of Henle, there is a decrease in GFR, and it is by countercurrent exchanger, glomerular tubular balance, tubulo-glomerular feedback, countercurrent multiplier. With increased flow to the loop of Henle, decrease in GFR is due to. No, we studied about the tubulo-glomerular balance. Whenever there is an increase in GFR, it is going to increase the sodium chloride, which is filtered, and that is sensed by this macula densa, which act like a GFR sensor. So it is going to increase the release of adenosine. So adenosine is going to cause a vasoconstriction and the GFR decreases. So whenever the GFR increases, the flow to the loop of Henle will increase. So flow to the loop of Henle is causing decrease in GFR, and this is why the tubulo-glomerular feedback. So answer is C. Everybody, is this clear? No, it is not a glomerular tubular balance. Do reply fast. Is this clear? Okay, that was the last question of today's session. If anybody has any query regarding the GFR, you can ask in the session. Is this clear with everybody? The GFR part? All the concept regarding the GFR is clear with everyone? So that's all for today's session. Hope you all like the session. If you like the session, do share. Do like and share. That is important. जितना ज़्यादा share करोगे उतनी ज़्यादा class interactive होती है. So do share and subscribe our channel, that is Unacademy Live NEET PG. And press the bell icon so that you will get notification of any upcoming classes. So do subscribe our channel and press the bell icon so that you will get notification of every class. We will take that diagram in next session. All the layers of glomerular capillaries and the Bowman's capsule. Okay. So that's all for today's session. Hope you all like the session. Do share. Let's crack it together. Do more and more MCQ. That is only the key for success. More and more revision and more MCQ. You will definitely able to achieve your target. You will definitely crack your exam with good rank. That's all for today. Thank you so much for joining. This is the code Dr. Nidhi. If anybody wants to join any paid course, you can use this referral code to get additional 10% off. You can follow me on Unacademy also. My page on Unacademy is unacademy.com/KGMC. You can follow me out there. This page link is also given in the description box, so from there you can access this page. That's all. Thank you so much everybody. See you all in the next session. Bye bye everyone.